a few words on Imaginize. We are located in Orsay, close to Paris. We built the company in 2003, so there is a whole story, not always in retinal imaging, but in aberrometry in the first part of the life of the company. So we learn a lot to how to measure very well an eyes, and we had some competencies in adaptive optics. So we developed an adaptive optics imaging device. Mission is really to save sight, to make the best contribution as possible to save sight and even to save life by providing extremely accurate information on the retina, which are either retina health information, but more global health information in the retina. Because you can see vascular details in the retina, you can see, you can detect some hypertension parameters or things like that. So it really can go far. We believe that this technology that I'm going to show you there is a new gold standard, can become a new gold standard in retinal imaging. We are a small company, you see 20 people, 3 million of sales, but we have a strategic partnership with Imagine Optic. I'm also the co-founder of Imagine Optic. So I want to say a few words on Imagine Optic in 30 seconds. So Imagine Optic was built in 96, so nearly 30 years ago, and we are focused on wavefront sensing techniques, especially Shack-Hartmann techniques, and adaptive optics solutions. So there is some sensors, some deformable mirrors, systems based from optical metrology, and various kind of system for adaptive optics solution. Imagine Optic is not working in ophthalmology because we have this daughter company, which is Imaginize, working on this topic. So the total group at the end of the day, it's about 100 people working on this topic. What is adaptive optics? So it was introduced by astrophysicists who wants to look at the sky, the deep sky, and what happens is that because even with big telescope, you are traveling through atmosphere, the image is blurred. And is blurred because of wind in high altitude. And the wind is going to introduce aberration on the optical path between the star or the group of stars you want to see and the detector. So if you introduce adaptive optics, that I will just behind, you are able to improve the image drastically. You can have some very good details. This is the center of the galaxy, and I will show another image in the next slide on that. So you can see there is a real improvement of the image, and this is exactly what we are going to apply in the eye. So here is the basic principle. The distorted wavefront is arriving in a system, and it's going to be measured by a wavefront sensor, but on the optical path, you are able to place a deformable mirror. Deformable mirror is a membrane that can be addressed by pistons, by actuators locally, and then can change of shape locally. So you can have a shape which is exactly the inverted shape of the aberration of the incident aberrations. And then you can correct that. So here you can see there is a wavefront with some astigmatism, which is a classical aberration due to the atmosphere, which is going very fast. And then at the end of the day, you have a good wavefront, quite uniform in color. So that means a few nanometers or tens of nanometers of aberration instead of a few hundred of nanometers, even a few microns of aberration here. You can see the same kind of image. This is the galactic center. And if you have a classical telescope, you see just light. And if you use adaptive optics, this is what I've done. Andrea Guess in 2020. Well, she was Nobel Prize in 2020, and then she were able to see the stars that are at the center of the galaxy, and she observed that the star at the center of the galaxy have a specific movement. This is how she detects that there were some massive holes at the center of the galaxy. So we are going to apply this to the retina. If you look at a retina with a classical device, typically the resolution, the spatial resolution is about 20 microns. So when you zoom, you can see this kind of image with some shadows of vessels, maybe some small structure that you can try to imagine. Then if you are able, so this is not exactly the same as in the atmosphere, but the light which is going in your eyes is going to be distorted by the cornea and by the crystalline, which has some aberration, which are not good optics, and which are changing from one person to another one. So it's quite static aberration. You don't need to go very, very fast, but then you have to correct that in order to get this kind of image. This is all the spots that you can see here are cones. So you're able to see dynamically. This is a live image of the retina. It's a quite small field, of course, but you can see really microstructure, micro details in the retina. You can even make some segmentation to count the cells, to count the neighbors of the cells. This is some kind of biomarkers. I will make a list of biomarkers that we have in hand, thanks to this system. So there is a lot of application, and I was saying in my title, early detection. Yes, early detection, because you can see some details at the cellular level. So then if there is some change in the structure, because of the higher resolution and the higher level of details, you can have some very smart detection of change. You are able to monitor some therapy. You are able to evaluate the progression of a disease in the eyes after just a few weeks. I will show some image on that a little bit later. So we have developed two devices. The first one, more than 10 years ago, it's AO fundus camera, classical fundus camera, and the RTX1. It is a certified system. It's very easy to use. Adaptive optics is, there is a reputation of that adaptive optics, it's a difficult technology to handle. But here, in that case, ophthalmic doctors are just placing the patient in front of it, and they make the acquisition, and everything is completely, fully automatic. And in the same way, we have done now a new device, which is at a prototype level for research use only. And this one is a multimodal, multi-scale, and I will detail it a little bit later. Now, just focusing on the RTX1. So you can see, oops, sorry, up. So you can see the standard image. You already seen one. We can add a module to change the lighting. So you can see some pigment epithelium and RPE cells. So it's a different layer. You can add some other modalities for research, especially for research, that allow to make lots of papers. So we have lots of scientific papers, more than 250 papers. And then this device is also now used because it offers a lot of possibilities in new biomarkers. We have developed some tools for imaging protocols to make imaging protocols in case of clinical study or clinical trials. So more than 250 publications, more than 20 countries for more than 100 units already sold worldwide, especially in Europe, but also in the US. In Europe, it is certified, so there is no need of specific um, legal process. In the US, you need to get an IRB. And I could add on this slide that there is, in adaptive optics, which is a quite new technology, there is a little bit more than 50 or 55 studies right now on clinicaltrials.gov. And you can check that there is more than half of them that are done with this device. A lot of them are done at the academic level, but more than half of the clinical trials are made with this device. You can see Michel Pack is someone who adopted the technology very early, and lots of papers are on inherited retinal disease, but also on AMD. Well, there is a lot of application. The list of AO biomarkers that we have been able to demonstrate and to work on, and we're still working on in clinical trials, and more especially one that could interest Gianni on atrophic AMD. We are able to measure short-term general atrophy, geographic atrophy, sorry, progression. Here you can see there is two image. Okay, you can see that. So this movie on the right, each image is between 2 weeks and 1 month change. So you are not obliged to wait for 6 months before seeing the change in the eyes and evaluating the damage of the disease. But every 2 weeks, you can have an image and see the progression of a few range of cones that are disappearing. This is the lesion is in that area, and this is the safe area, but you see that things are moving. There is some dark points that are kind of proteins, pack of proteins that are changing also of place. So very interesting way of seeing the atrophic lesion, how it change. And of course, because it is very fast, then you can see how a treatment can be efficient in a few months instead of a few years. So you can save pharma companies, therapeutic companies can save a lot of money in the clinical trials thanks to that evaluation. Now checking just one slide on N2 OCT, which is a new device supported by Europe. We have a lot of support from Europe since a long time. So you can see all the modalities. We have, in that case, large field modality with SLO, OCT, OCTA. And then once you're able to check the location of interest, then you have the zoom with the adaptive optics modality, the adaptive technology which enhance the modality. So you can get high resolution in IOSLO in phase view. Then you can have the high resolution, cellular resolution in AOCT, and you have a very fine description of vessels in AOCTA. Some reference paper indicated here. You will have the copy of the slide, of course. And then, so we are working right now with Netherlands group to introduce AI in image analysis in order to make some evaluation of very early capillary damage or damage in the nerve fiber for glaucoma evaluation and glaucoma progression of the disease. So very, very promising device to provide a lot of information. Just to summarize or to open the discussion, but so adaptive optics is not very known right now in that field, but this is, you have really the most advanced industrial adaptive optics retinal imaging system with the RTX1 that I just introduced. We can improve all kind of existing modalities, even on specific development. The higher resolution provides earlier diagnosis. The highest resolution provides faster and less expensive drugs development. And my conclusion is that we believe really that adaptive optics is a game changer, not only in the ophthalmology field, but also for global health and wellness. And why I say wellness, just I can explain, because we start to work on neurodegenerative disease, and we have some intuition, let's say intuition right now, because there is not yet the demonstration, but that we can detect probably 20 or 30 years before Alzheimer context in the retina. And so that means wellness, because then the people and the family can be prepared to this disease. And of course, if tomorrow there is some treatment for that, the people can apply this treatment, at least in the food or in some other process to decrease the speed of progression of Alzheimer's disease. And so the epic questions. So we are selling the full device or some of the components. We are open. The components are integrated in other technology. We are offering a unique expertise to reach the retina with a cellular resolution. That means if you apply a laser, so not sure that it is interesting for Gianni, but if you want to make some surgery, you can reach the retina with the smallest resolution as possible in order to preserve the health of healthy cells inside. And what we are looking for, just in the industrialization of the new device, the prototype, the multi-scale and prototype, the M2 OCT, we are looking for swept source. So we are working right now with a 200K kilohertz swept source, but probably we have to decrease a little bit this performance to make it more affordable for the market. We are looking for low-cost SLED in that range, a few milliwatts, not critical, but really low cost. And in human resource, we are looking for a clinical application specialist. If you have this in your network, don't hesitate to transfer the information. Thank you very much.